Well, South Africa, as we know, still reeling from the devastating effects of the hard lockdown when COVID-19 first entered the country last year. Well, some experts say it helped slow down the rate of infection. So what is needed to help stem this third wave, which is fueled by the highly contagious Delta variant? Let's speak now to Malan from the Bhekisisa Centre for Health Journalism. Mia, good afternoon. And what are your expectations of the President tonight? And whatever he does, do you think it's going to be too little too late, especially for us in Gauteng?
Well, as you've mentioned, we've got the Delta variant circulating in South Africa now, and we know that there is rapid community transmission, and also that it's the most transmissible variant we know of in the world at the moment when it comes to COVID. And we also know that we are running out of hospital beds in some provinces, particularly in Gauteng, where some patients already have to be transferred to other provinces. So if we look at these two issues, most experts agree that we need to do two things. We need to use tools to manage hospital beds better, and secondly, we need to try and slow down the spread of the virus, although some people argue it's already too late. Now, if we look at an indication of what could we see, then the Chair of the Ministerial Advisory Committee yesterday, Koleka Malisana, indicated that the MAC, the Ministerial Advisory Committee, that they were thinking about restrictions on movement and also smaller gatherings. And my understanding is that the MAC did recommend that we move to a higher lockdown level than what we're currently in. So if we look at the management of hospital beds, we know from Medical Research Council studies that hospital beds open up when we ban the sale of alcohol, because alcohol is associated with interpersonal violence and also car accidents. So we have fewer trauma admissions to hospitals. So a ban of alcohol sales for the peak period of the third wave is something that is definitely perhaps under consideration, and that I think the MAC would have been likely to recommend. It's obviously up to the National Corona Council and the President and the Cabinet to see if they accept that. And also, if we look at the peak of the second wave during January earlier this year, the curfew was a stricter curfew than now. We now have a curfew from 10 p.m. to 4 a.m. During that time, it was a curfew from 5 a.m. to 9 p.m. at night. Of course, there are economic implications for this, and we know that Business South Africa and the Black Business Council have made pleas for the President to consider the impact of such measurements on the economy. So we might, for instance, in the case of restaurants, see compromises, such as, for instance, no indoor dining, but outdoor dining might be allowed. And when it comes to gatherings, we know that at the moment, with the rate of infections in the country, if you are in a group of 20 or 30 people, it's highly likely that there will be someone who is infected in that group, and that it could become a super spreader event. So we are likely to see a reduction in the number of people, particularly indoors, that can gather, to, some experts say, as low as 10 people. Currently, the restriction is 50 people. And there are different opinions on the closing of schools. But if you live in a province such as Gauteng at the moment, and we have teachers who are being vaccinated, and yes, kids don't fall sick, but if one of those kids infect a parent who need a hospital bed, that parent is highly unlikely to get a hospital bed in Gauteng at the moment.
Yeah, if I can ask you very, very quickly, we are out of time already, but do you think that these restrictions will be blanket, or should be blanket restrictions for all provinces, or mostly for those that are problematic, like Gauteng? Very quickly for us, please.
So our restrictions, our restrictions do allow for different provinces to have different restrictions. But the reason why it hasn't been done up until now is because provinces are generally 2 to 3 weeks apart from each other. So if Gauteng is high now, we know the Western Cape is going to come next. And that if you then have different restrictions for provinces just 2 to 3 weeks apart, then it becomes very confusing for people to follow. So it remains to be seen if people see that, but definitely the reason in the past was that the MAC argued it would be too confusing, and you would have to chop and change it all the time, because the provinces, there's no real borders between provinces, so the infections flow pretty quickly.